On to this now. Discussions and debates continue about the introduction of the National Health Insurance. Government says NHI is one of the ways to resolve unequal access to health care. Well, Gauteng MEC Bandile Masuku unpacks the crisis in his Gauteng hospitals here, but also the budget limitations of his department. Jane, he joins you.
Thank you. Good morning to you, MEC. Thank you very much for coming in.
And good morning, and thanks for having us.
There's a crisis in Gauteng's hospitals, particularly facing cancer patients. I mean, there are reports that some of them could wait up to 3 years for their treatment. What's gone wrong there?
I think we had two problems the machines that we were using, both in Steve Biko and Charlotte Maxeke, were old and were out of service. So we are in a process of commissioning new ones, which by November they will be actually commissioned and will be starting to work. They are new, faster, and they are modern machines that will help us to catch up with the backlog. But we also have derived another plan which will see us purchasing some service from private to be able to meet the requirement and reduce the backlog. The whole thought and objective is to try and get, when these two machines in these two hospitals start to work, at least they must start at a point where the backlog is actually at zero. And we are in negotiations with the private sector who have the machines and who have the equipment, so that we're able to reduce the backlog.
How did we even get to this point? I mean, how is it allowed to even reach here where there is this backlog, where we don't have 12 chemotherapy machines, lack of morphine?
No, I think the problem has always been that in Gauteng we have got a serious budgetary constraints, and which have actually impacted on the service. And if you realize, in the past 3 years in Gauteng we have not had any infrastructure development that we have done in the Department of Health, only because we wanted also to try and normalize the budget and reduce the deficit. And at this point we
make sure that budget actually goes
to where it's supposed to be,
other than being siphoned off.
I think it's going to be like that, and we have actually succeeded in doing that. The budget deficit is coming down. We also have received a clean, unqualified audit for the first time, and I think we are in the right track in terms of stabilizing the finances of the department. Okay,
you say you're aiming for a 0% backlog, but you've got a lot of patients to work on. I'm just wondering what the conversations are, excuse me, with them, knowing that they have to wait regardless, the sort of trauma that they should be going through, I should imagine they're going through.
Yeah, I think it's one of the things that I've also personally experienced, because I'm from in the clinical area and I deal with women with cervical cancer, where we could have been able to resolve it as quickly as possible. We find that the cancer has actually slightly advanced. But we are dealing with them, and we're hoping that by the time the November time comes, when we commission the two machines, the backlog would have been done and would have moved on it.
Okay, but how do you look after them in the meantime? I mean, cancer is not something that you can really tell to wait.
In the meantime, the problem is that, cancer, as you say, it's scientifically an uncontrollable disease. And the issue is just to control the symptoms and make their quality of life actually bearable.
And you'll take that cost on board?
Yes, we're going to take the cost on board, and it's one of the ways that we're going to demonstrate to the public and the citizens of Gauteng how, when we are able as the government to purchase services from private, it will be able to actually give us better options and better quality for our patients, and actually reduce waiting time.
A lot of people in this country are in a panic about the NHI. I mean, we've seen the state of our hospitals, the exodus of highly skilled medical staff, lack of nurses. Many people are not going to university anymore to study the nursing, to get nursing qualifications. I mean, how do you appease them that what's happening right now is heading in the right direction, that money, those billions aimed at this, are not going to be siphoned off to people who don't need that money?
Corruption is a big problem that we need, all of us in society, to deal with, and particularly for us in government, that we need to actually sort out. And I think we need to be serious as government and also demonstrate where we find wrongdoing, that we should show this, the community and the society that we can be able to deal with it. But in a bigger sense, the panic is not actually necessary, because when we talk about NHI, we are not talking about the system. We are talking about the funding of the system. And we all know...
But sorry, excuse me, that's where the panic sets in. I mean, funding of anything linked to the government sets panic, because the trust is broken. So I'm just wondering what's going to be different this time.
I'm not sure what's the panic, because I think, like I said, that corruption is a societal problem. It's not only in government, it's also in private. And I think if in a real sense we all had to be actually panicking, it means we should be putting all our efforts together to make sure that we deal with it. Because in private it has been shown, demonstrated, and maybe it's undersaid when it's in private, but it's something that we need to deal with. And we are confident that having turned the corner with the new administration, we'll be able to deal with it and utilize the funds effectively, and particularly when it comes to health, that it's going to be a zero tolerance on
Great.
that.
So it'll be taken seriously, and those affected particularly by cancer will get their time hopefully soon.
No, they will, and it's not only those who are affected by cancer, it's also those who are waiting for hip replacements and knee replacements, and also who have got delays after trauma. But we also have to accept that the burden has increased, and the complex nature of the disease of cancer is no longer the same as it was 10 years ago, and we have the burden. And the backlog could be that if we have used other provinces, the backlog could have not been in Gauteng alone. So we also deal with the immigration and the numbers that we actually have to service.
Mr. Masuku, thank you very much for coming in. Really appreciate it.